So I'm going to address the mechanisms and methods for a culture of wellness. I think that's driven by a culture of compassion. In fact, as Flo mentioned, the well-being crisis. I think right now we're suffering from somewhat of a paucity of compassion crisis. And so I'll start on a little bit of a downer in thinking about that. And I'm starting there because I'm not going to stay there. I think healthcare is a unique opportunity to be a big part of the solution to that problem. So those are my objectives, and we'll include some strategies that we've tested that have shown some promise. So we'll just grab this so I can move around. So no secret that we have a polarization problem in our culture. This is not new to any of you. And it turns out that's a barrier to cultivating good relationships and inspiring change. This is somewhat scary data. This is data showing that around 2012, we crossed an ominous line. And that line is that we had more hate on average for the out party than love for our own in the United States. Think about the implications of that and what that does to our political landscape, to our communities, our relationships. We've seen families break relationships with each other over political discord. We see much hate, and this is predictable. The outcomes of this kind of division are ominous, predictable, and documented. This is data from FBI hate crime records, and we saw a similar rise in 2001, right after the Twin Towers were hit. But that was temporary. It came and went. Whereas if you're feeling like I am, that something went additionally wrong around 2019 with the onset of the pandemic and hasn't really recovered, then this data suggests that you're right, as hate crimes have climbed and they've stayed high. And the 2024 data is now out, and it's just as high. This affects us. It affects everyone. I think it affects people in healthcare in unique ways sometimes. This is, I don't know if I have a clicker to make this go. Let's see if there's a way. Can you make it go from the back? And before you play it, just give you a little bit of background. This is a neurosurgeon from Hennepin County in Minnesota. And I resonated with this in some ways because one of the fathers of the clinician well-being effort, Mark Linzer, works there. So I thought of Mark when I saw this video. And this is a poignant example of the ways some of these factors can affect us in healthcare. Let's see if we can play it. If not, I'll just tell the story. Oop, no sound. Okay, I can just tell the story. This is a neurosurgeon who took care of one of the 15-year-olds who was shot in a hate crime, shot while praying in a church. And the neurosurgeon is simply saying, and you can see his affect, that he said, I hope politicians can get through their head, how difficult it is to tell somebody's parent that their child has been shot in the head. And he said, I hope that can get through our politicians' minds as effectively as some of these bullets do. And you can feel his emotion when he said that. And so if you're like me at this point in our discussion, you're feeling a little bit heavy, so we can turn to Yoda for some comic. Oh, now it does play. Maybe this will. I was wrong. I apologize. I can play it. We'll see if this one has sound.
I hope someday we can get it through the politicians' thick skulls. How terrible it is to tell a 12-year-old's parents that their child has been shot. I hope it would get through their skulls, that message, as well as some of these bullets do.
Okay. Then a little bit of wise counsel from Master Yoda. Oops. Maybe you can do that for me again. Your magic.
Fear is the path to the dark side. Fear leads to anger. Anger leads to hate. Hate leads to suffering.
And compassion is the solution. Compassion is unselfish love for others that is cultivated in awareness and bears the only fruit capable of calming fear, neutralizing hate, and healing humanity. And this is where healthcare comes in nicely. Good healthcare and a culture of wellness at work in healthcare is motivated by compassion. And it turns out we're wired for compassion, and it's a special kind of compassion. It's not just tribal compassion, where we love only people who are like us or agree with us. In healthcare, we strive to have compassion for everyone and to provide compassionate care for everybody who walks through the door. And that is special, it's unique. We see this in extreme examples even, where physicians are expected to, and often do, provide compassionate care for people on the other side of the fence in a war. Provide compassionate care for those who are expressly considered enemies. So we're very wired to provide good care for people who are unlike us in every way and people who disagree with us sharply. And to do that, it starts with, I think, creating a culture of wellness at work. And I define a culture of wellness at work that's motivated by compassion as valuing ourselves, valuing our colleagues, and valuing our personal relationships. So we'll start with valuing ourselves. This is also called self-compassion. And there are just 4 items that we use to measure this, and it's fairly intuitive. The first 2 items are on a measuring failure of a growth mindset. The ideal is having a growth mindset rather than a self-condemning response to errors and imperfections. And then the second 2 items assess appropriate prioritization of self-care. So here are the first 2 items. When I made a mistake, I felt more self-condemnation than self-encouragement to learn from the experience. And second, I was less compassionate with myself than I was with others. And we use a 2-week time back window so we can measure change over time. And then the 2 items on self-care. I put off taking care of my own health due to time pressure, and taking care of my needs seemed incompatible with taking care of patients' needs. And if you decide to try that, you can go to our website, WellMD at Stanford. If you type in WellMD, you'll find it immediately. And we have a section where you can look that scale up and test yourself if you want to get your score. And the scores are fairly normally distributed. This is a sample of physicians. We're seeing the same patterns in nurses and in healthcare executives, so everybody on the healthcare team. A lot of the organizations that are using these measures are using them in all of their workforce. And we see the same kinds of relationships and patterns in everyone. So everybody in healthcare is responding to the same kinds of things in the same ways. So 8 is average. If you do this and get a score of 9 or higher, that's pretty good. These scores are extremely correlated with everything else that has to do with wellness. I'll just tell you about one. We think a lot about burnout. That word is a word you've heard many times as the clinician well-being movement has taken hold. And higher self-valuation scores, I'd say higher because even those are negatively worded, we reverse score them so that never is 4 and always is 0. And so higher scores correlate with better things. And this is a graph showing each incremental improvement in self-valuation, how that associates with the lower burnout scores. Such that burnout is extremely high at the lowest end of self-valuation and almost non-existent at the highest end of self-valuation. Turns out this concept of self-compassion is also related to our physiologic health in interesting ways. This is a study that used a different measure of self-compassion. And in this study, the researchers, after getting compassion scores from the entire group of participants, and splitting them into two halves, those with the highest half of the scores and those with the lowest half of the scores, took all of them through a stressful experience. And this stressful experience was simply to stand in front of two people dressed in white lab coats, looking very stoic, and with the responsibility of speaking for 5 minutes on why you're so well suited for your dream job. And then immediately afterwards, counting backwards by 17s from 2053. And it turns out that that experience for the average US citizen causes distress. And then the researchers measured interleukin-6 levels in these participants. IL-6 is a marker of inflammation. Inflammation, we know, is associated with all kinds of nasty diseases. So inflammation is no good. And the researchers found that those with the higher scores in self-compassion had lower interleukin-6 levels at baseline before the stress test was started. And then after the stress test, they had a lower increase. So they didn't have as much of a rise in this inflammatory marker as the other participants who had lower self-compassion scores. So better off at baseline and then less of a hit when stressful things happen. How many stressful things happen in healthcare? Self-compassion is an extremely important buffer to those stressors. Unfortunately, on average, among physicians at least, we don't do that well on this construct. We tend to have lower self-compassion than workers in other fields. This is a group of physicians. Those are the red bars, and the green bars are workers in other fields. And these are the people who answered often or always to one of the questions on that scale. It was the question that was stated, when I made a mistake, I felt more self-condemnation than self-encouragement to learn from the experience. And at every work hour category, so it wasn't just because of busyness, at every work hour category, physicians were much more likely than workers in other fields to indicate that that's the case, that often or always they were responding to their own perceived errors in these ways, in this way. And then this is where we really needed to divide by work hours, because we might think that putting off self-care due to time pressure is only a function of having too much to do, working too many hours. But it looks like it's beyond that. It's a mindset. It's a self-sacrifice mindset that goes beyond just number of hours worked. Because here we see at every work hour category. So when we compare physicians only to workers in other fields who are working the same number of hours, then we see that even then, they are more than twice as likely as workers in other fields to state that often or always they put off taking care of their own health due to time pressure. We know that physicians are at higher risk for burnout than workers in other fields, and so are most other healthcare workers. Nurses are at higher risk for suicide than workers in other fields. It turns out when we look at the burnout data nationally, we see that every survey that in this particular year, physicians had 51% greater odds of burnout compared to workers in other fields after adjusting for demographic factors. Then in a second model, when we adjusted for those two self-valuation questions that I just mentioned, then physicians were no longer at higher risk for burnout. And in fact, when we adjusted for those self-valuation items, work hours, sex, and age category, then physicians actually had lower risk for burnout. It was 18% lower odds of burnout compared to workers in other fields. And that makes sense to me because the kind of work we do in healthcare is remarkably meaningful. And so if we can do it with a sense of grace and self-compassion, then we're going to be, on average, happier than average. And a lot of you know that. In fact, that's why most of us went into this field, because we know there's a sense of joy in being part of an effort to provide compassionate care for others. So leaders play an important role in creating a culture where self-valuation can flourish. One is simply by modeling it. Modeling a growth mindset when confronting personal errors and imperfections. And modeling appropriate prioritization of self-care for well-being and performance. And then in doing that, teaching others to do likewise. After modeling self-care and that it's okay to take vacations and in fact encourage, and it's okay to try to schedule work demands so that at least on some days I can make it home and be on time for obligations at home, and that it's okay to take time when needed to get medical attention myself. When I do that and then teach others that, and I really do expect you to be able to do so as well, and everybody on my team believes that because I model it and I empower them to do likewise, then that makes a big difference. And then, of course, we can teach others within their sphere of influence, the managers and others on our leadership teams that are interacting with people that they lead every day. We can help them with gentle feedback and modeling ourselves and teaching them how to do likewise for those that they lead. We do see a relationship between good leadership and self-valuation in those that they lead. This is a study looking at self-valuation scores and professional fulfillment scores and perceived autonomy scores among those who are engaged in the work and their ratings of their leaders. And those that feel like their leaders are doing well in wellness-centered leadership behaviors, supportive leadership behaviors, have better self-valuation, greater perceived autonomy, and improved professional fulfillment. So leadership is playing a role in improving self-valuation and in creating a culture of wellness where valuing ourselves is possible. We've been talking about just culture for 25 years now. This original publication was in the year 2000. An important aspect of a just culture for me to keep in mind is the simple concept introduced by a now somewhat famous parenting book author, Becky Kennedy. Some of you may have heard of her work, read her work. The concept of most generous interpretation and least generous interpretation. That really resonates with the concepts of creating a just culture. And it's so simple and easy to remember and to teach when we are discussing things that go wrong in healthcare, the bad days. Then being able to ground our just culture conversations in pursuing the things that that may have contributed to an error, implementing this simple concept of let's make sure that when we're thinking about each other and ourselves, that we look at the most generous interpretation. And when we see things that seem like they're blaming, then to be curious about whether or not we're acquiescing into a fear-based, least generous interpretation. We might fear that if we do that, if we're too easy on people, if we're always giving them the most generous interpretation, they'll feel good about themselves, but they'll start being lax. They'll make more mistakes. And even if we don't feel that way about others, we might feel that way towards ourselves. So it's important to know that we see actually the opposite is the case. That acceptance of human limitations and pursuit of perfect medical practice are likely to be two sides of the same high-performance coin. The way we know this is we see that in our data when we've looked at self-valuation scores and medical errors, that those who have higher self-valuation actually end up having fewer medical errors, not more. We wouldn't ever want to, though, teach that it's okay to make mistakes. How many of you would want to send your loved family members to physicians who feel like it doesn't matter if I make mistakes? None of us. And yet we do know to err is human. And so how do we balance then this need for acceptance of human limitations with what can be a very healthy drive and striving towards perfect medical practice? There's research that might help. It's an old study in 2008, and it looked at the aspects of perfectionism to try to suss out what might be okay for our well-being and what aspects of perfectionism really are getting at damaging factors that attenuate our mental health. And what these researchers found is that striving for perfection, wanting to be perfect, is fine. It's nothing wrong with that. It doesn't hurt our mental health. It's probably good. We're always going to want to grow and improve. That's great. When we get in trouble is that it's almost impossible for some of us all of the time, and for all of us some of the time, to disentangle our desire to be perfect from contingent self-worth, which means that we are at risk of feeling really terribly about our intrinsic value when we make a mistake. And if we can change that and embrace a more unconditional sense of self-worth, grounded in faith, grounded in all things good, realizing that we deserve love and good things and don't have to earn them any more than the grass on the field has to earn sunlight, that our worth and the intrinsic value we have is just inherent. If we can do that and believe that, then we can strive for perfection without damaging our mental health. And the other aspect of perfectionism that got in the way of mental health is the need to hide, the feeling that if people know what's really happening with me, things are going to go terribly. So there's individual interventions clearly help with improving self-valuation. Those include coaching. We see lots of evidence that good coaching can improve self-valuation, certainly includes psychotherapy. Mindfulness meditation training is when people want to do it and sign up for it and go through that kind of training, improves self-valuation dramatically. Offering screening instruments so people can get feedback and see where they're at. That simple intervention can help. And then those screening instruments can be integrated into larger general physician wellness surveys as well. This is from a neurosurgeon at Stanford, Paul Kalanithi. He wrote this book on When Breath Becomes Air. After being diagnosed with cancer while dying, he wrote this book. And one of the quotes from his book is, "You can't ever reach perfection, but you can believe in an essence towards which you are ceaselessly striving." And that's the right mindset. And then let's think then about valuing our colleagues. I'll go straight to an intervention where I think, made some difference in this. An interesting thing about this intervention is we sought to measure an impact not just on participants. We wanted to get as many people in the population to participate as we could, but we wanted to measure the outcome in everybody, regardless of whether or not they participate in the intervention. We wanted to show a population-level effect. And closely related to compassion, certainly related to valuing our colleagues, is the concept of gratitude. And ended up in this intervention, that ended up being the star component. So we used a popular opinion leader approach. The popular opinion leader approach you can find in the CDC website under the Interventions That Work section, or at least that's where we found it many years ago when we tested this. And we find popular opinion leaders by simply using a one-question survey where we sent to all of the physicians and advanced practice providers in the clinics where we were conducting the intervention and where control conditions would be the case, and asked them to identify who they respect most, both personally and professionally. And they told us, And we looked at all the results, and then the people who got the highest number of nominations were our popular opinion leaders. And we went to those people and had a conversation that went something like, your colleagues have a lot of respect for you. It turns out that what you recommend and what you say is likely going to be listened to. We want to create a culture of well-being in your group. Would you be willing to help? And they all said yes. And so we involved them in helping teach. At a very minimum, they encouraged everybody to come. Those that wanted to were more active in their teaching. And we focused on 4 different topics. Gratitude, which again is the one that seemed to be the secret sauce. Cognitive reframing, where we help people think more compassionately about themselves and practice alternative self-talk when they make mistakes or perceive errors. And a third lunch session was on mindfulness, and then the 4th was on whatever the group wanted to do. And a fair number of the population did participate. 75% attended 1 or more sessions. And we looked at the results. The results were obtained by looking at the year-over-year surveys. And in this case, the surveys were incentivized. So there was a 96 to 98% response rate every year. So we really did measure pretty much the entire population, not just the 75% who participated. And we had 20 different practice groups who were part of this intervention. We randomized 10 to active intervention and 10 to control. And the 10 that did the active intervention did better over time relative to the control condition who got the intervention after we finished the study. Their professional fulfillment had a better trajectory. Their burnout had a better trajectory. And self-valuation wasn't moved. So we know our self-valuation effort flopped. That didn't help. But the gratitude effort really did. That stuck. Subjective gratitude, just overall perception of gratitude. Perceived gratitude, which is the number of times I'm hearing gratitude expressed towards me. Express gratitude, the number of times I'm expressing gratitude for others, and then an average of all those measures were better in the group that were participating in the intervention. And what we did to cultivate gratitude was rather simple. One was a simple gratitude exercise. We asked people to think about one thing somebody did for them at work, and something they did for somebody else at work, and that they were grateful for, and then one other good thing. So then share that with somebody sitting next to them. And then we encourage them to continue that gratitude exercise for at least 14 days, writing every day about something I'm grateful for that I did at work, something I'm grateful for somebody else did at work, and then one other good thing. And then in addition, we put envelopes in a location in the workplace where everybody could see them, and we had these gratitude cards people could fill out and then put them in a mailing system. And those gratitude cards were, I don't know if I have them here. Yes, there it is. Allowed people to enter a thought on what somebody that they worked with had done and then mail it off. And that would go to one of the executive leaders. And the executive leader would compile those and send a handwritten letter to the person who had gotten those comments saying, your colleagues are saying this about you. Just wanted you to know. So that was the other piece of this. And that seemed to create a culture of gratitude that made a difference on a population health level. I'm tempted to try that gratitude exercise here. I'm going to wait. We'll see if we have time towards the end. It'll come up again in a context of a different intervention. Turned out that this intervention also may have saved Stanford a lot of money. This was the University Health Alliance clinics that are part of the Stanford umbrella. And when we looked at intention to leave differences in the intervention versus control group, and then computed the intent to leave to actual likelihood of leaving from previous research we had done, and we estimated that in turnover cost savings that the organization may have saved almost $2 million, $1.75 million in turnover costs from this intervention, which even though we had spent a lot, not just on the intervention, but on the evaluation of it, that even in the more resources intensive version that we did with robust evaluation that wouldn't necessarily have to be redone in every application of it, that the return on investment was over $6 saved per $1 spent. So now let's go to the third piece, valuing our personal relationships. We measure this with a 4-item scale as well. And here they are. In the past year, my job has made it harder for me to nurture existing personal relationships and made it harder for me to develop new meaningful personal relationships. 3, contributed to conflict in my personal relationships. And 4, contributed to me feeling more isolated or detached from the people who are most important to me. And this took off at Stanford when we looked at the relationship between our well-being measures and in physicians and unsolicited patient complaints. So we measured well-being in the physicians and then tracked complaints in their patients. This is a tracking system actually conducted by Vanderbilt University, the PARS system. Unsolicited patient complaints are a strong marker for a liability risk. It's one of the reasons the university is interested in them. They're also a rough indicator of patient care quality. When patients are complaining about the care they receive from a physician, sometimes that indicates something has gone awry. And it turns out that when work events are so caustic and work schedules are so caustic, unreliability of schedules are so pervasive that healthcare workers are unable to maintain or develop meaningful personal relationships. That affects their well-being in such profound ways that it begins to erode their capacity to show up and provide compassionate care at work. So much so that it was more related to unsolicited patient complaints than any other factor we measured. We published this. Burnout was related to unsolicited patient complaints. Low professional fulfillment was as well, but only before we adjusted for impact of work on personal relationships. After adjusting for impact of work on personal relationships, maybe because we didn't have enough of a sample to deal with the correlated factors that make it hard to show combined effects, but certainly it was the largest effect. It was the most robustly associated factor. Anxiety, depression, even sleep-related impairment were not the factors that stood out in relation to unsolicited patient complaints. It was this factor, impact of work on personal relationships. And when we demonstrated that in our research, our administrative leaders were interested and supported an intervention that we wanted to try. I'm going to tell you about that in just a few minutes. Here, too, healthcare workers struggle. This is a national study looking at this construct compared to workers in other fields. Blue bars are physicians, yellow bars are workers in other fields. And these are the percentage of respondents who answer at least moderately true to the question, in the past year, my job contributed to me feeling more isolated or detached from the people who are important to me. And again, at every work hour category. So yes, work hours makes it harder to show up in personal relationships in reliable ways. But it's not just work hours, again. It's a mindset. It's beyond just work hours. Because at every work hour category, in other words, when we're comparing physicians only to workers in other fields who work the same number of hours, physicians are much more likely to indicate that their job is contributing to them feeling more isolated or detached from the people that are most important to them. Outgoing Surgeon General emphasized the importance of addressing the epidemic of loneliness in the United States and recommended that workplaces put in place policies that protect workers' ability to nurture their relationships outside of work, including respecting boundaries between work and non-work time, supporting caregiving responsibilities, and creating a culture of norms and practices that support these policies. So there are some specific things we can do. We published some recommendations. One is improving cost coverage of EHR inbox and other clinical care demands. We think a lot of our organizations, a lot of your organizations are probably doing this already or working on it. Optimize scheduling and coverage so physicians leave work at reasonable times in the evening, at least on most days. Everybody understands not being reliably home on time on an evening of being on call. It's much less easy to understand if it's every day. And we see this sometimes in our procedural-oriented healthcare teams, where things are scheduled unreliably. And so even on days not on call, getting home can be hard. Imagine the stress that might create if it's my turn to pick up kids at the daycare that day. And so being able to think about scheduling so people can get off on reliable times, at least on most days or some days. Improving predictability of work schedules, that's exactly what we're talking about, that third piece. All right, and then implementation of new models of team-based care to optimize task distribution. We can be more efficient when we encourage everybody to work to the top of their license and figure that out. All of you are working on these kinds of things already, I'm sure. And then evaluate and optimize timing of meetings to minimize encroachment on personal time. Try to have work meetings during work, retreats that are for our workforce only during work time, those kinds of things. Then the other side of the coin is related more squarely to the culture of wellness, is interventions that target our actual cultural norms and attitudes towards impact of work on personal relationship. Now, leadership training is part of that. Training leaders to understand the importance of these of impact of work on personal relationships, and how that affects our organization's success in being able to retain workers and be able to have a workforce that shows up able to do their best. Policies and communication campaigns that communicate these same messages for all of our healthcare workers is another important component of an effort to mitigate impact of work on personal relationships. And then lastly, the experiment that I'll tell you about, which is a weekend retreat for physicians and their spouses. And we actually did this. We did it and tested it. We had a quasi experimental design. So we had a fairly equivalent control group. It wasn't randomized. We had some divisions that we allocated to intervention and other divisions and departments that we allocated to a control condition, and invited everybody in the active intervention departments to participate in a couples retreat. And then those that were in the control group, we gave them the opportunity to attend the same couples retreat afterwards. And we're now systematically inviting all of our faculty members to come to a couples retreat. And we do have a parallel track for people who are single, that is a retreat to come and think about relationships and have a time to consider these things in a meaningful way as well. And our couples retreat has been remarkably popular. It's based on positive psychology principles, so we emphasize growth and gratitude for each other, and simple concepts like prioritizing the personal relationship and prioritizing time together. We also give couples a time to learn from each other in small groups, and have some didactic sessions where we teach them some important principles to help physicians and their spouses understand what I call the Achilles heels in healthcare workers, which are strengths that, when run amok, can become weaknesses. And I'll tell you about what some of those are, four that we've identified and discussed at our couples retreat in a minute. Well, here they are. So one is a deferred gratification. It turns out that professional training and work is the ultimate marshmallow experiment. And if you haven't heard of the marshmallow experiment, I'll tell you about that really quickly. It's a study on 3-year-olds, and the study gave all the 3-year-olds a marshmallow and then told them, if you wait for a few minutes and don't eat it when I leave, when I come back, I'll give you another marshmallow. And then the researchers followed the kids over time, and those that were able to wait and get their second marshmallow did much more in life. They did better in life. They probably much more likely to become healthcare workers. And the problem is, if 50 years later you're still holding your marshmallow, it may not be going as well. And so being able to think about that and how it affects our relationships. When deferred gratification means deferred time with people that we love most, then that can take a real toll over time. And a related strength is the constant drive to do and serve and accomplish more. It's interesting that physicians, being some of the busiest people on the planet, are more likely than workers in other fields to have an imposter phenomenon of not feeling like they're doing enough. We know that from our research as well. So that also gets in the way, because then even when relationships are a priority, if I'm constantly feeling like I'm not doing enough, it's hard on any given day to find time for the things at home that seem important to me. My daughter taught me how to resolve this when she was 8. She was learning about time management in elementary school. And so she came home and she asked me to do something with her. And I gave her my usual, at the time, unrefined, uninformed answer, which is, well, I'll try, but I have a lot of things that I have to do. And she looked up and she said, Dad, I've got this. I'll tell you how to do this. And she sat me down, she took out a piece of paper, and she drew columns and rows. She said, make these columns your days and these rows your hours, and put all the stuff you need to do in this schedule. And put some times so you and I can do this on that schedule. So you have all this stuff in your schedule, and then do it. And she's spot on. It seems so simple. And yet that act of faith, of really including what's most important to us, can be hard unless we actually implement those third-grade solutions. Also, a strength is our ability to find and solve problems. Where that can be a weakness is when we are constantly in the mindset of finding and solving problems. Then we struggle sometimes to see the good moments, the good things that are ubiquitous, but missed. One way this comes up for me, if I'm not attending to what's important, is I can be treating my driving as a problem to solve and getting from point A to point B in the constant hurry, and seeing the bad things, the obstacles, and that eliminates the opportunity of enjoying the people who are with me. My daughter used to teach me about this too. This is when she was 5. And I was a young physician at the time. And somehow she'd be in the back seat and she'd be talking to me and I'd be listening. And then, I'd start, getting in my problem solving mode driving, and I'd lose track of what she was saying. And at 5, somehow she could sense that, and she'd say, Dad, are you listening? Once in a while I was tempted to lie. I learned quickly, though, because whenever I did, she'd follow up with, okay, what did I just say? So, one way to mitigate that problem is, again, implementation of positive psychology. We can practice simple gratitude practices. So we practice 3 good things in our relationship retreat as well. We encourage people to name 1 good thing that somebody had done for them. And in our couples retreat, we encourage them to have that be 1 good thing your spouse has done for you, and then 1 good thing you've done for your spouse. And for a more general audience like this, it's broader. In fact, I'm somewhat losing track of time, but I'm getting close to done, so I think we have time for this. Why don't we try this? This is a fun exercise. So rate your mood on a scale of 0 to 10, 10 being the best mood you can possibly imagine. So rate it right now, but commit to a number, think about it, or write it down. And then let's try this simple exercise. So name 1 positive thing that you did for somebody else that you're grateful for this week. It can be anybody. And in a moment, I encourage you to share any of this, at least one of the things you come up with the person sitting next to you. So you don't have to share them all, but write at least one thing that you don't mind sharing. And then the second piece of the three is name one positive thing that somebody else did for you. So something that you did for someone else and something that somebody else did for you, both of which you're grateful for. And then lastly, anything else that you're grateful for. So follow those instructions. I'll give you a few seconds to think about that. And then I'll let you share one of those things with somebody sitting next to you. And if you have a table of 5 or 7, then some of you will be in a group of 3. But all of you should be able to find a group of 2, a group of 2 or 3. So share it with somebody sitting next to you. So I'll give you a second to finish your thoughts, and then we'll give you a chance to share.
Right on timing, so we're doing great.
Okay, when am I supposed to quit? I think I have like 4 minutes
10:20.
left. Okay, we're going to do great. I'll hit that on the notes. I'll hit it. Goodness. Okay. Try to wrap it up in the next 30 seconds. Thank you. Thank you for your willingness to engage in this conversation. It's actually a sign of success, and it warms my heart that it's hard to get everybody's attention after this exercise. Thank you. Thank you for doing that. And as you've finished, then rate your mood again on a scale of 0 to 10 and see if it's changed. See if it's gone down, stayed the same, or gone up. If it's gone down on a scale of 0 to 10, then what you've just engaged in is exposure therapy, because that would mean you're like me and you're a little bit of an introvert, and that's uncomfortable. But then the more we do that, then the more comfortable those conversations are over time. So I think you still won, even if things got worse. But then let's by those who are willing to vote, how many are in that camp? How many notice that their mood on the scale of 0 to 10 got worse? Raise your hand. Okay, no entrenched introverts here. Okay, then how many have noticed that it got a little bit better? Wow, it always blows my mind how successful that is. And it's always the case, which speaks to the value of that. And cultivating relationships, cultivating that interpersonal gratitude. One of my colleagues recently did a study on 2 brain MRIs, functional MRIs, and found that of all the things that she had people discuss, it was gratitude that created the most interbrain coherence, resonance between 2 people in their brain activity. So a state of unity, which is the ideal fertile ground for cultivating compassion for each other. Last of the strengths is our exacting standards for perfection. That is a strength that we've identified. We want that. And yet we've already talked about how that can run amok in low self-valuation. So there is growth opportunity. We find that healthcare workers do get better at this over time. Those that are over 60, particularly over 65, tend to be doing better than younger colleagues. So one strategy for everybody else is just to wait it out. Alternatively, good coaching, good therapy, contemplative practices. I think the good faith-based practices can also help a great deal. So are things we can do to grow and improve in this way. Our couples retreat was then founded on this initial commitment to spending time together, which was realized in a practical way by getting away from everything and spending 2 days in the Santa Cruz Mountains together. We then taught the principle of turning towards, of being able to listen for subtle bids for connection and get to saying yes to those as often and as consistently as possible. And when unable to say yes, say not yet, because I need to fix X, Y, and Z, but would love to later. And then finally refining our capacity for mindful communication and good communication. We had a couple of follow-up sessions, 1 month and then 2 months later, to reinforce some of these principles. And all along the way, couples were encouraged to set goals, to prioritize each other, and work on specific things that would enhance their relationship. And it worked. Relative to our control condition, the impact of work on personal relationships went down. It went down practically too. There was a big difference. But then in the controlled analysis, there was a statistically significant difference as well. The size of the change was meaningful as well. Self-valuation improved. We find that self-valuation and good, healthy relationships are very intertwined. One reason is defensiveness. If I feel in the court of my own mind like I'm always on trial, then anything somebody says that could even be construed as criticism is going to be hard to hear. And that sets up difficult relationship dynamics. So being able to wrap our minds around that and cultivate high self-valuation matters, and that seemed to be part of what people were able to do as part of this couples retreat, in addition to committing to their personal relationships in practical ways. Burnout went down. In fact, it was burnout that had the biggest effect size reduction, which is surprising to us, as well as the specific components of burnout. And I'll end with this research from 2010 to remind us of how important these dynamics are. Our relationships at work and our personal relationships. It turns out that social connection and relationships have a bigger impact on health than anything else that we track in public health. Here are all the comparisons. Relationships then are the big bars, the big bars on the top. The social relationships overall, and then specific high versus low, and then a complex measure that included the quality of social relationships. So it's really that third bar that has the best assessment of the health and robustness of social relationships. And when we look at that one and then compare it to smoking status, alcohol use, preventive care, flu vaccines, air pollution, exercise, body mass index, all those meaningful, and those are important too, all those meaningful public health indicators that affect our morbidity and mortality pale in comparison to the effect of relationships in our lives. So why not in our well-being focus on that? And it's compassion that drives it. Compassion motivates the culture of wellness, and all of us can work within the sphere of influence that we have opportunity to work within to do our share. Our culture shapes us, and we shape our culture. Each one of us holds one share in the culture that we're a part of. And we can cultivate our natural tendency in healthcare to promote compassion in ways that really do create the force that will heal humanity. Thank you.